today we are going to look at the respiratory system. Alright, so the respiratory system has three main functions. The first is to provide structure for the exchange of oxygen and carbon dioxide. So what does that mean? That means that it provides all of the tubes, the alveoli, the capillaries, all of that stuff. It is responsible for the production of sound, and it is responsible for the physical and chemical process by which we change that oxygen and use it for metabolism and release the carbon dioxide. 4 divisions of respiration, so you saw a little bit of this on your web quest. This was that last question. So ventilation is air moving in and out of the lungs. External respiration takes place between the alveoli and the capillaries, so that's where the oxygen and carbon dioxide change places. We have the transport part. It gets sent to the body, and then internally, this is where the cells are going to take that oxygen and exchange it for the carbon dioxide. The pathway. So you saw this on the web quest also. It starts at the nose and the mouth, then goes into the throat or the pharynx. Then we have the nasal pharynx. We have the oral pharynx, and we have the laryngeal pharynx. These are telling you exactly where they're found. This should not be confusing to you. The larynx is a voice box. Trachea is your windpipe, and that's at the front of your neck, right where you feel it. You can feel all the little cartilages. It's at the very front. Bronchial tubes is where that trachea splits into 2, and then those 2 branches branch off into a whole bunch of branches. That's the bronchi or bronchius. Alveoli are those little grapes, and then capillaries are those little strings that cover the alveoli. So when we look at this, we've got our nose and our mouth. It comes in. So this would be my nasal pharynx, my oral pharynx, and then as it comes down and we meet up with the voice box, there is the laryngeal pharynx. The trachea is going to be the tube in front. The esophagus is in back behind it. This is my trachea. It branches into my 2 bronchial tubes, and then it branches even further into the bronchius. Here's just a more detailed picture of the nose, and you can see the concha. You have the superior, middle, and inferior. Those are just like walls with some little indents in it that help to warm and moisten the air as it comes in. So my nasal pharynx, my oral pharynx, and then as I get down close to the voice box is my laryngeal pharynx. Okay, and then you can see the esophagus keeps going down. That's in back by the spine. And this would be my spinal cord right here. And then the air will come in front. And right here is my trachea then as it goes down. This we're going to look at later. This is an epiglottis. This is a little flap of cartilage that will come down and block the trachea. So when you swallow, that food only goes in your esophagus. Here's another picture that shows the right lung has 3 lobes. The left has 2. The left more space is taken up by the heart, and that would be why. Here is my alveoli. You can see all these bronchius branching. At the end, they look like little grapes. They're alveoli, and they're going to be covered with the capillaries. Inside the cells is where I exchange oxygen goes in, carbon dioxide comes out. So during that gas exchange, the alveoli are really, really thin. And that is where that exchange is going to take place. It takes place through diffusion. When the oxygen binds, it forms oxyhemoglobin. And it can form a bicarbonate then. Surfactant is a fluid, a little fat fluid on top of the alveoli that makes them nice and slick. So we've looked at this process when we did the lungs. So this is just a reminder of that. Again, this is from yesterday, from that web quest, a reminder of stuff going in, stuff going out, inside the alveoli, and then inside of the tissues. So understand that all of the pathway for air is just tubes except for the alveoli. All along the way, the air is purified, humidified, moisture, and warmed. So it's cleaned, you add moisture to it, and you warm it up. That is the whole point of the nose and everything below it. If it does not happen when you breathe through your mouth. So the nose does this. Mucus in the nose moistens and traps the debris, and then we have foreign things that eat it, and that's how we get our boogers. You do have cilia inside the nose that helps move stuff. If you get a lot of stuff, it can send it into the stomach. The septum, we know sept, wall, fence, divides the nose in half. The concha we looked at on the picture. Their job is to increase the surface area. You have sinuses. We talked about those. And you have the paranasal sinuses, frontal, sphenoid, ethmoid, and maxillary. Tonsils, pharyngeal tonsils, palatine tonsils, and lingual tonsils. Lingual should be the tongue, like bilingual, you speak languages, you use your tongue. Palatine are on the palate. Pharyngeal are by the pharynx. Your larynx is your voice box. The epiglottis we talked about, that's the flap of cartilage. And then the glottis is the opening between the vocal cords. The trachea does have C-shaped rings of hyaline cartilage, and you can feel those. It also contains cilia inside the trachea and inside your lungs. If you smoke, that cilia will be destroyed. During puberty, the male's vocal cords are going to become larger, and that makes that Adam's apple stick out more. The right lung is shorter because of the liver, and then your pleura is also your lung cover, and we've already done that for several chapters now. Normal breathing rate, females are going to be higher than males. When you're younger, your breathing rate is higher, and it gets lower as you get older. When you're sleeping, laying down, it's lower compared to when you're standing up. As you get older, your breathing rate goes right back up. Coughing. A coughing is going to come from your lungs. It's forceful. Compared to a sneeze is going to come from your nose or your mouth area, and it's going to be forceful. Hiccups is the diaphragm is spasming, and a yawn is just going to bring extra oxygen into your blood. Your medulla oblongata is in charge of your breathing rate. We've already talked about that before. Inspiration is going to bring air in. Expiration is going to send air out. You can consciously control your breathing, but understand that at any point your brain can override that conscious breathing. The lung capacity, you have tidal lung volume, which is going to be what you can normally breathe in. Inspiratory reserve is what you can take above that. So you can always take in a really deep breath. Expiratory reserve, I can exhale a large amount above what I normally exhale. And then what is the total of that? Residual volume is going to be how much air doesn't ever leave your lungs. It has to keep your lungs just a little inflated. You do have some sounds that you make when you breathe. So if you put a stethoscope up, you can hear that. If you do hear a crackle, a bubbling sound, it means you got some mucus or pus. So you could have pneumonia or have some breathing problems. Wheezing is going to cause a whistling. When you have asthma, you usually hear that wheezing sound. All right, so we talked when we did medical terminology. A in front of a word means no or not, and nia is breathing. So apnea says I stop breathing. Dyspnea is I have difficult or painful breathing when I breathe. Urapnea is easy breathing. Hyperapnea is increased breathing. Ortho, straight. When I'm in the horizontal position, I have trouble breathing. Tachyapnea is going to be fast breathing.